I am going to do one more special spotlight before we wrap things up. If folks can stick on, I know we're right at 8 right now, but this is not to be missed out on. This year was special in a lot of ways. I hit on a couple right at the top, but I want to spend a little bit more time talking about how unique the efforts were on our response to the migrant crisis in Chicago, specifically, but not exclusively, with the mobile health clinics that we set up in a matter of 10 days. With an amazing team of volunteers. So the city approached us to see if we could join other provider teams who were going to set up mobile health clinics because new arrivals were being housed temporarily at that point at police districts. We didn't know what the summer was going to look like. We thought maybe we were signing on for a couple of weeks. And we said, yep, we'll figure it out. And so 10 days later, we went out for the first time. So on May 24th, we did our first mobile health clinic. And I was with that crew. We went to District 18. I know Amy was with us. And I was with most of the team I was with on that day, me or my other team members who ran those, every Wednesday and Friday for 16 weeks. We went out twice a week for those first 3 months, scaled down to once a week, and did incredible work. This is something Community Health had never done, did not think we were going to do. And then I would say we really did a pretty kick-ass job of it, if I can. And that really is because of the people I want to spotlight right now. This was a massive team, but there was a core crew of us, and I see many of you here who were there every single week for 16 weeks. Some of you twice a week. Corali, I see you on here. This was incredible because everything was changing all of the time. It was new to us, and then it was new to us the second week because something had changed, and it was new to us the third week because another thing had changed. Some of it was good because we had new ideas, we had new resources. Some of it was challenging because our access to space changed or whatever it might be. But because we had that same dedicated crew, we built on every single time we went out, and we were able to provide great care. We were able to bring patients into care at the clinic. We were able to set a positive atmosphere in an otherwise challenging atmosphere, where though the situation was really tough, I always felt, and I believe all of our volunteers who have talked to me about it, our interactions were always positive. We always set a loving, caring tone. It was friendly. We got to know people, and we provided support. We provided resources, and we connected as people. So I would like to give a special, amazing, giant, shining shout out specifically to our providers who came out, almost all of you every single week, if not alternating weeks. Amy Schroeder, who was my Wednesday provider every single Wednesday. Friday crew, Isabel, Polsky, Margaret, Bavis, and Barbara Shaw. Like, you guys were it. We had a couple other supporters, so I'm going to shout out the others, but every week for 16 weeks. This was incredible. And then I want to shout our support team specifically, and Corali, Medico, who I think hopefully is still on, and Miguel, Gutierrez, I don't know if you're on. Getting to know you all and working with you this summer was incredible. You all were so kind. You were so flexible. You were so proactive. I didn't have to worry about a thing if I saw your names on the list. I didn't have to tell you what to do. The tables were set up in a second. We have more of my team. I see Katie nodding. Emily started helping to run these clinics, and I knew I could throw them in and just be like, don't worry, the team has it. And you did. So just a giant thank you for making this possible, making it positive. And then special shout outs to lots of other folks. We're running out of time, so I'm not going to list everyone, but that wasn't everyone. Specifically, Tanner Schull and Michael Cisneros also came out a ton over the summer. I see not you all know them. Sarah, who I think isn't on anymore, helped several times. Aida, I think you're on the call still. You came out. It was such an amazing team effort. We registered over 250 patients over the summer just through our mobile health. We provided over 225 screenings in these settings. And then by bringing folks into care at the clinic, we provided well over 150 clinic visits, and that's just over the summer. The work has continued thanks to our partners. So thank you, thank you, thank you. I can't believe what we accomplished, and I know it's going to continue to morph into new innovative ways of providing care in 2024 because you all showed us what we can do. So I'm just endlessly grateful. And I do want to do one last call out, though I know he had to drop. Dr. Medina also brought in the St. Joe's program and texted Milan and then called me, and we figured out how to get more of those new patient clinics through our partners with St. Joe's. So a huge thanks to our partners at St. Joseph Hospital who helped us amp up our on-site support so that we could get all of these patients into care at the clinic. This was just, I think, the perfect example of community health and what we can do. We can work with our partners, we can work with our volunteers, we can work faster than pretty much any other health center because we have you all and no red tape. We can try new things and we can provide care where it's needed. So thank you, giant shout out to this team